Afternoon, everyone. Thank you very much for joining us today. So the session we're running today is on searching for literature to support evidence synthesis. So just before we start, I'd like to do an acknowledgement of country. So the Child and Adolescent Health Services acknowledges the Whadjuk and Binjuk people of the Noongar Nation as the traditional custodians of the land, sea and waters on which we live and work. We pay our respects to the elders past and present. CAHS is committed to working towards a better future where all cultures are respected and valued and Aboriginal people take their rightful place as the first Australians. So welcome to our Research Skills Seminar series. We run a number of sessions over the year, about 25 topics, and they are designed to provide a 1 hour rapid overview on a range of research skills and a range of topics that help to cover the research process. So if you haven't been to one of our sessions before, welcome today. The sessions are recorded and will be uploaded once the session is finished, and we do encourage you to give us some feedback, so hang around at the end and we'll put a QR code up, or if you have a hand copy paper, you can provide feedback, written feedback to us. This helps us to improve our sessions in the future and get ideas on how we've gone overall. Just some housekeeping, so please hold your questions to the end. I will run around with a microphone at the end for those in the room. For those online, please put your question in the chat box and someone will read it out for you, and hopefully we'll be able to understand your questions, so try and make it very succinct and clear for us so we can make sure that Sarah can understand what you're asking. So just before we get started, I'd like to welcome Sarah. She's a senior librarian and provides a literature searching service for systematic reviews and other evidence synthesis to staff across East and South Metro Health Services. Sarah previously assisted researchers navigating ethics and governance applications at the East Metro Health Service Research Hub. So please join me in welcoming Sarah for her talk today.
Thanks everyone for joining me today for this session on searching for literature to support evidence synthesis. The aim of this session today is to provide you with the information and tools to allow you to create a robust and comprehensive search plan. So a search plan to be able to retrieve the relevant information to support your evidence synthesis. In this session, I'll briefly talk about what evidence synthesis is, why it's important, things to take into consideration before you start, and how to avoid research waste. But the majority of the session will be on developing and executing your search plan and the tips and tools that can help you to do that. So first off, what is evidence synthesis? So I've used a definition from the Cochrane Handbook there, so combining information from multiple studies investigating the same topic to comprehensively understand their findings. I've used the definition from the Cochrane Handbook because that has been internationally recognised as a gold standard resource for evidence synthesis since its first print publication in 2008. And I will refer to it a little bit more throughout the session, so I just wanted to highlight that at the beginning, just to let you know that it is the gold standard resource. So basically what we're talking about studies that have pulled together, analysed and comprehensively summarised all of the relevant evidence for a specific topic from a body of research. So the key characteristics of an evidence synthesis is that they are replicable, they're transparent in their methods, they follow a rigorous methodology, and they aim to minimise bias by using explicit systematic methods documented in advance with a protocol. Really important to document your methods in advance with a protocol to avoid that risk of bias and have a rigorous, valid piece of research at the end. Evidence syntheses are quite impactful within healthcare. They allow clinicians, policymakers and other stakeholders to make informed decisions about healthcare and policy, and they also allow for achieving improved patient outcomes. So the studies that fall under the umbrella of evidence synthesis are studies like systematic reviews, but with and without meta-analyses, scoping, rapid and umbrella reviews. Now, sometimes you might notice, or you may have already noticed, that evidence synthesis can be used interchangeably with systematic review within the literature. However, evidence synthesis does actually refer to all of these types of reviews. So I mentioned earlier that evidence synthesis are quite impactful within healthcare. So I just wanted to have a further look at the value and the impact of evidence synthesis in healthcare. So as I said, they allow clinicians and other stakeholders to make informed decisions, but they also allow them to make these decisions efficiently. So we all know that finding and staying up to date with the best available clinical evidence can be really challenging, mainly due to the vast volume of evidence that is available, but also the speed at which it grows. So that's why evidence syntheses and systematic reviews are considered the gold standard for evidence-based practice. So you can see that they're sat right at the top of the evidence pyramid there. And the reason for that is that they consolidate and interpret information from multiple sources so that clinicians and policymakers who are resource and time poor don't have to read lots of individual studies to make those informed decisions. They also help us to minimise research duplication, and that allows us to avoid wasting funds and resources that can actually be used elsewhere. They identify gaps and inconsistencies in research, and this can help to indicate possible directions for future research. And they're also transparent and replicable. So a good evidence synthesis will allow you to pick up and carry on from where the last person left off. Now, in saying that, just because something is referred to as an evidence synthesis or has review in the title doesn't automatically mean that it is of a high standard. So if you are deciding to use a systematic review or some other type of review to support your evidence-based practice, please always make sure that you critically appraise that review using an appropriate tool or checklist. So one of the aspects when you are actually appraising some sort of review, and when you're deciding if it's up to standard, is looking at how the research team searched for the studies that they included. And the reason for this is that the search is the foundation for the review. So the search determines the literature that you find and that you will conduct your review on. So therefore, a robust, comprehensive search provides you with the basis for a really good and valid review. And these are things that you just need to think about when it comes to conducting your own evidence synthesis. So will your search stand up to critical appraisal? And to ensure that your evidence synthesis is useful and valid, there are some other things that you need to take into consideration also. So before you start, you need to think about things like your time and resources. Can you commit the time and the resources that it will take to conduct this review? So evidence syntheses are time and resource intensive. For example, with a systematic review, the minimum amount of time that it can take to do a systematic review, complete it from start to finish, is 12 to 18 months. And the screening of the search results requires a minimum of 3 people. So can you commit that time? Do you have those resources to do that? Are you prepared to follow rigorous guidelines to ensure that the end product is of value? Have you got a well-defined question? Have you got a well-developed protocol with clear eligibility criteria? As I said at the beginning, this must be done before you begin searching to actually reduce the risk of bias in your review. Have you also reviewed the existing literature to ensure that you're not duplicating a study or a review that has already been done or is in the process of being done? So reviewing the existing literature can not only help to avoid duplicating research, but it can also help you to check for studies on the same question to further refine your question, or find on-topic papers that you can use in your reference set for your search. And what I mean by reference set is, so they can be called reference set, seed papers, goal papers, verification set. They are papers that are on topic for your question, and they're used to verify your search. So they're papers that you have identified and you've determined that they must appear in your search for your search to be valid. So you'll use them throughout your searching process just to make sure to verify that your search is staying on track. So if you or your team are not prepared or not able to commit to any of these things, it will affect your search strategy, and it could result in your study contributing to the already high levels of research waste that exist. So I mentioned earlier avoiding research waste, so we'll briefly have a look at that before we get into the development and execution of searching. So research waste has been a topic of discussion in the research community for a long time. Doug Altman first called it a scandal and discussed the huge sums of money spent annually on it in a 1994 editorial in the BMJ. In 2009, Paul Glaser and Ian Chalmers again talked about it in one of their studies, and they estimated that 85% of health research is being avoidably wasted. Paul Glaser again mentioned it in a keynote address that he did in 2020, and in 2020 he discussed that subsequent studies have indicated that waste levels since 2009 have not changed. So this diagram here, this is from the 2009 study, and it shows the stages at which waste usually occur. So from that diagram we can see that all of those things that I spoke about that need to be given proper consideration, if they're given proper consideration, you can avoid waste at these stages. So all of that being said, let's have a look at searching. So with evidence synthesis, because it covers various different review types, there's no real definitive set of steps involved. But this is kind of a general idea of the steps involved in reviews. So we've got the search strategy falling generally at about the 4th step in the process. And again, you can see those first 3 steps really cover all of those things you need to consider before you get started to ensure that your evidence synthesis is a valid piece of research. These are the steps involved in developing your search plan. Again, it's a general order of steps, and I say that because searching is quite an iterative process. So sometimes you will go back and forth between the steps just to improve on the search. So things to remember going into the development of your search is that searches for evidence synthesis must be comprehensive. So the aim is to identify as many relevant studies as possible. In searching terms, we talk about precision and sensitivity. So sensitivity is the number of relevant records identified divided by the total number of relevant records in the resource. So really what we mean is the ability of your strategy to find all of the relevant records for that topic. And then precision, we've got the number of relevant records identified divided by the total number of records identified. So by that we mean the quantity of retrieved articles that are actually relevant. So searches for evidence synthesis aim to be as comprehensive as possible in order to ensure that as many of the relevant studies as possible are included. And what this may mean is this may mean prioritising sensitivity over precision. And that if you prioritise sensitivity, it may result in relatively low precision. However, where you can, you would like to strive for a best compromise of the two, but just remember that the more precise your search is, the higher the risk of losing relevant studies. And remember, we want to find as many relevant studies as possible. The search also needs to be transparent. Your methods should be clear and properly reported, both before searching in that review protocol that we've already talked about and in the final paper. They should also be reproducible, so clearly documented so that the work can be replicated. So that means documenting where you searched, when you searched, how you searched, and keeping track of the search strategies that you used. So the first thing you want to do is identify the key concepts for your search. I find the best way to do that is to break the question down using a question framework, something like PICO, PEO, SPIDER. I've included a couple of examples on this slide here. However, I have also included in the resources that will go out, there's a paper that provides a list of the most common frameworks. PICO is a common one for intervention questions, but you are better to find the one that most suits your topic or discipline. So what a question framework does is it helps you to break your question down into searchable concepts. So we've got the example question here of, in adults suffering from migraines, is botulinum toxin type A compared to placebo effective at decreasing migraine frequency? So you can see I've broken the question down into the problem, intervention, comparison, and outcomes. So the aim of this is to help me to determine the searchable concepts for the search strategy. And when I say searchable concepts, this means the key aspects of the question that will translate into being searchable on the database. But the key thing to remember here as well is that you don't have to use all of the elements in your strategy. Some of the elements are actually better or more appropriately incorporated into your inclusion-exclusion criteria for your screening. So for example, something like adults would not be included in the search because it is not standard across the database. So the age ranges for adults may differ across the database, which means that your search is going to differ across the databases. So that's something that's better kept as an inclusion or exclusion criteria when you are screening your results. Also in evidence synthesis, we don't often search on outcomes because it's too broad. You can run the risk of excluding relevant studies if each and every outcome is not accounted for. And it's also possible that the outcomes won't be mentioned in the searchable fields. So databases don't search on the full text of studies. So if the outcomes are not mentioned in the searchable fields, you again will run the risk of losing relevant papers. And lastly, we want to avoid using too many different search concepts because this can narrow the search significantly. And again, we risk losing relevant papers in that way. So I find it quite helpful to create a simple table with a column for each of the searchable concepts that I've come up with. You can see here I've gone for migraines and Botox type A. So I like to create a table and then add in a row for our subject headings and free text terms. Free text terms can also sometimes just be referred to as keywords. So what this does is it can just help structure your thoughts and get your thoughts from the computer over to the database, from your Word document over to the database. So earlier I mentioned that we want to avoid using too many concepts. So as you can see, I've just gone for 2 here to avoid narrowing the search unnecessarily. However, when it comes to generating the subject headings and keyword terms to populate the search, we want to be as extensive as possible within each concept. And we also want to use a wide variety of search terms to combine within each concept. So what you need to do is take in each concept individually and think about the key terms that are likely to be used to describe your concepts. So first of all, you want to look at subject headings. Subject headings are the preferred indexing term of a database. They can also be called a control vocabulary or a thesaurus. And what it does is it provides a consistent and standardized way to describe and find information. So for example, preferred term of a database may be myocardial infarction. Now an article using only the word heart attack will be indexed with the preferred term of myocardial infarction to allow for discovery of that article. Do remember though that each database will have its own set of preferred indexing terms. So when it comes to adapting your search for across the databases, you need to remember that and incorporate the appropriate terms for that database. Within the databases, and I will talk a little bit more about them later, it's best to always make sure you know where your database guide or the help section is, because that's where you'll find all the information on that. So for your keywords and your free text terms, these are things, you're going to want to think about things like synonyms, regional spellings, natural language. So for synonyms and natural language, you want to think about things like pertussis versus whooping cough, or your myocardial infarction versus heart attack. You want to think about different terminology used in different geographic regions, so adrenaline versus epinephrine. You'll also have to make sure you're including all the different spellings and spelling variants, as for example, Australian versus American spelling, tumour with a U versus without a U. And then also you want to think about whether there is a commercial brand for a particular drug or device versus their maybe their pharmacological name. So for example, from our question here, we've got botulinum toxin type A versus Vistabex, which is a commercial name for it. So you need to keep a combination of both free text and subject headings for each concept of your search. So that all might sound very overwhelming, and where can I find all of those terms? But we do have some tools and tips here to show you where you can find options for search terms to populate your search. So earlier I talked about a reference set or seed papers. So if you've got on-topic papers, go through them, see what words they're using, see what the spelling variations are, see if there are geographical variations in there, keep note of those. If you can find other systematic reviews on a similar topic or on the same topic, have a look and see if they've published their search strategy. So a good systematic review will that has followed the PRISMA reporting guidelines. They will include their search strategies as an appendix or a supplemental document. So this can be quite helpful when looking for the synonyms or subject headings. But again, don't forget, make sure you use a critical appraisal checklist to make sure that it is a good search strategy. If you search in PubMed a lot, or you found a really on-topic article in PubMed, oftentimes there will be a link on the right-hand side of the page to medical subject headings. So these are those preferred terms of the database. So they would be for PubMed and Medline. And you'll find that in a link on the right-hand side, and that will give you all of the subject headings that have been assigned to that article. And also usually there's a list of keyword headings assigned by the author just underneath the article. And then there are quite a few online tools for text mining. I have only highlighted a few here, but there are definitely more out there, but these are just ones that I am familiar with and that are free to use. So you have PubMed Pub Reminder. So that's a tool for analysing PubMed search results, and it will give you a list of repeated words in a single paper, so you can see what's coming up time and time again to be able to populate your search with that. Voyant is a online piece of software, and that's really handy for word and phrase frequency, and it also provides information on the co-location of words. So that's useful where to help you identify where proximity operators and truncation can be used. I will talk a little bit more about proximity operators and truncation in a couple of slides, I think, but just bear that in mind, that Voyant is a good one for that. The Yale Mesh Analyzer is a really good one if you've got some PubMed IDs. You can chuck them into Yale Mesh Analyzer, and what that does is it actually gives you a table of all the mesh terms that these articles have been indexed with and the keywords. So again, you can see the frequency of the words coming up, and WordFreak, which is part of the Evidence Review Accelerator. That's part of the suite of tools from Bond University, and again it provides a list of terms in order of their frequency of use, so you can see which ones are being used the most. So now that we know how to break our question down and where to find our keyword terms and subject headings, what do we do with them? Where do we put them? So we need to develop our search somewhere, and there are so many different resources that you can use to search. But the main advice I would give you on that is consider your topic and where the relevant information will most likely be found for your topic. Once you've decided what resources are most appropriate for your topic. Also, make sure that you check that you actually have access to these resources through either your health service library or a university if you are studying. The library subscriptions across the various health service libraries actually differ, so always check that you have the required access before you start your searching. It is really important to give just as much attention to where you search as to actually creating your search, because the best search strategy in the world is going to be of very little value if you're not searching in the correct place, because you're just not going to find the information that you want. So check where the relevant information for your topic will most likely be found, check you have access, and add those resources into your search plan. So I'll talk a little bit about databases now. There are two types of databases that we use for evidence synthesis. So we've got our bibliographic databases. So that includes Embase, MCARE, CINAHL, and Medline and PubMed. So I've put those together like that because PubMed is the open access version of Medline. So they have the same holdings. It's just one is open access, one is a subscribed version. So our bibliographic databases organise the records of published works, and they index with keywords and subject headings. Whereas we've also got citation index databases. They're like Web of Science and Scopus. They don't index with subject headings, they only index with keywords. And their main goal is to track article citations and research impact and evaluation. So you would have to, your first step then with the databases is putting together your search strategy on a bibliographic database. So that's going to be your primary database, and once you're happy with your search on there, you'll translate it across to other databases. With your systematic reviews, so for like a Cochrane systematic review, there are some databases that are considered non-negotiable. You have to use them for a systematic review, and those two, they're the two core international biomedical bibliographic databases. They're Medline and Embase. Other guidelines would also be of the same opinion that they are the non-negotiable databases, but it does depend on the type of evidence synthesis that you're doing. And there are other relevant guidelines for the different types of evidence synthesis. So always check the guideline and follow that, because that will guide you as to where you'll find your information as well. So as I said, these databases, the bibliographic ones, usually have their own control vocabulary. Some of them will actually, when you input a word, they'll actually automatically map and tell you what the preferred subject heading for that word is. So that can be quite handy in finding your subject headings. And it's also useful to keep that in mind as well for when you're adapting your search from one database to the other. It is definitely useful to include a citation index as well, because they offer sort of a broader coverage than the biomedical databases, and they just don't have the control vocabulary, so your search may not be as precise, but it does often retrieve additional results, just either due to the different approach or because it has that broader coverage. So again, the database guides will guide you on how to use the specific database and the correct symbols and operators that you will need to put your strategy together. So operators like and, or not. These are often referred to as Boolean operators, and they're commands that are used to combine your search terms and concepts together. So or will expand your search. So you use this to combine all of your subject headings and free text terms within one concept. So for example, coming from our example of Botox and migraine, we've got our concept of migraine here, and you're combining all of those to find results including either term. And will narrow your search. So once you've expanded your search concepts using or, you'll combine the two concepts using and to narrow your search down to just those results that deal with both of your concepts, or if you've got more than two, all of your concepts. Not will exclude a concept, but it's not recommended to use evidence, or use not in an evidence synthesis search. Again, you may run the risk of losing relevant papers if you do that. So this I know is all kind of quite abstract, but I do have an example of a search put together with the search operators, and I'll discuss it all in context in a couple of slides' time. So other search operators are things like truncation, wildcards, proximity operators. So for truncation, a lot of the time it is this asterisk symbol, but again, always go back to your database guides to make sure that you're using the right symbols for that database. So truncation can be used for singular and plural forms of a word and for alternate endings. So here you've got, we've cut off diabetes at that T there, so that can find all those various different endings. So diabetic, diabetics, diabetes. Do use it with caution, however, and make sure that you are truncating in the right spot. If you have a look there at the fibre example, where it is truncated there, it will find the two different versions of fibre, but it may also find really irrelevant words like fibrous and fibrillate, and that's going to blow your search results out unnecessarily. So always use truncation with caution and just figure out exactly where the best spot is to pop that symbol in. Wildcards are used for spelling variants. So that little question mark in haematology there is telling the database that where that question mark is, there is either a character there or there is no character there. So it's going to find haematology with or without the A, same with something like pediatrics. Just pop it in where the A would be, and it will find the two different versions of that the two different spelling versions of that word. Proximity operators are really useful to sort of help you tidy up your search, or where you've got kind of phrases that can just differ slightly with one word. So the example here, we've got breast cancer or breast carcinoma. So instead of writing those out as breast cancer or breast carcinoma, you can tell the database to find breast next to carcinoma or next to cancer. So I've got two examples there. One is from Medline, or the Ovid platform, so it's the ADJ, and that's again just saying find it next to, or I've got the Web of Science version as well, breast near to cancer or carcinoma, and what that's saying is find breast within 2 words of cancer or carcinoma, and it can also be in either order. So basically it could find cancer of the breast as well as breast cancer. Some other search operators are your phrase searching. So phrase searching is telling the database that you want all those terms together in that specific order. Now the reason that's important is because some databases have a default of including and between words in phrases. So this is telling the database find it in exactly that, or those 3 words in exactly that order, rather than those words within any spot and combined by and. And then you've got your search fields. So depending on your search topic, it might be appropriate to search only in certain fields. If it's a very well-known topic, if you think there's a lot out there on it and you might generate noise, you may be best to just search in the abstract title and keywords fields. However, if it's a relatively up-and-coming research area, you might want to expand your search a little bit more and search in a multi-purpose field or a topic field, because that may pull in some extra results for you, particularly in a topic that may not have a huge amount written on it. So here's an example of all of the search terms combined in a search strategy. So I like to do line-by-line searching because it allows me to see where I've made errors really easily. So if, for example, I've put in a search term and it's giving me 0 results, that might indicate to me, oh, actually, I've done something wrong in that line. I've spelled something wrong. Or if I'm getting a lot of results, it may indicate that, again, that I've done something wrong. I've included too much. So you can see in this example here that I have taken all of the terms that I came up with in that table earlier, and I've searched for them line by line within each concept. So I've first looked for all of the terms that I found related to Botox, and I've combined them in line 5 there. So you can see that 1, 2, 3, or 4. And then I've done the same for migraines and combined them in line 8. And then I've taken those 2 lines where I've combined everything and brought it all together with and. So you can see that line 5 and line 8 have quite substantial numbers, but when you combine it together with and, it really reduces your numbers to give you only the results that are talking about both of your search concepts. So just a quick word on some of the symbols in that search strategy. So where you've got that slash, that is denoting that it is a subject heading, so one of the preferred terms for that database. Where the migraine disorders has that EXP in front of it, it's basically saying that migraine disorders is this sort of overarching heading, but there are other disorders included within that. So that's where those Alice in Wonderland syndrome, migraine with aura, all of those are also being searched for as well, because you have exploded the migraine disorders. You can also see there I've used an adjacency type 2, or an adjacency 2 on line 2, and that will help to find things like not only the botulinum toxin type A, but it will also find botulinum neurotoxin type A and botulinum type A. I've also included the truncation in a couple of different areas there, and I think that is all of them, yes. And also you can see there I've got the clinical versus the the commercial versus the pharmacological terms for Botox. So a lot of people ask about whether to use limits and filters in their searches. In evidence synthesis, it's usually recommended not to use inbuilt limiters. Again, just because you do run the risk of losing relevant records. So limiters are inbuilt in a database, and they usually limit searches by date, language, or methodology. So as I said, it's not recommended to use them, but there is one time where you would use a date limiter, and that's if you're rerunning your search. So say it's been 6 months, 12 months since you first ran your search for your review. You'll want to rerun the search to pick up anything new that's come out since the first search was run, and that's when you would use a date limit. Filters are search strategies that have been designed to retrieve specific types of records. So it could be something like randomized controlled trial records only, and they're usually developed and validated by experts. So where you actually have, if you do want to use something like that, you have to have a strong justification for including it. And where you do have that strong justification, then it's recommended that you use a validated filter. There are lists of validated filters out there. There's a specific website dedicated to those validated filters, and I have included that in the resources that you'll be sent out after the session. So it's also really highly recommended that you get your search strategy peer reviewed. So what this does is it allows for discovery of errors and also input of ideas from the person who is peer reviewing. Where possible, get it done by an information specialist, so for example a health librarian, but otherwise if you can't get that, get a colleague to do it for you, and they can use the press guideline statement and checklist to guide them through what they should be checking. It's really important to get it peer reviewed just to pick up on any of those errors, and it's also been shown that peer review using the specially designed checklist can actually improve the quality of searches. When you're translating your searches, when you've had your search peer reviewed, so your primary search peer reviewed, that's when you want to take it and translate it across to the other databases. So when you're doing that, make sure you keep your primary search open on the original database to cross-check. Check for the most suitable headings, so the suitable subject headings. Always know where your database guide is and keep checking that up. I do systematic review searching all of the time, and I still always make sure that I go to the guides and make sure I'm using the correct symbols for that database. Something else that you're going to want to search in is clinical trial registries, if there are likely to be any clinical trials underway or completed in the past that are relevant to your study. It will definitely depend on your topic whether you think you need to search there. Database searches will pick up publications related to completed clinical trials, but it's really good practice to actually search the clinical trial registries to pick up clinical trials that are yet to be started or in progress. And this helps to reduce the risk of publication bias, where only research with positive and desired results actually tend to get published. You can't search on these as systematically as you can with databases, and all of the registries have different search interfaces. Now, there are a huge amount of different clinical trial registries, so I don't have the time to go into detail about searching them today. I could probably dedicate a whole other session on how to search in them. But there is an amazing resource that I have linked to in those resources that will be sent to you after this session. And that talks about they link to a huge number of trial registries around the world, but they also provide a guide on the functionality and how to search them. So it's really, really useful. One thing I will say about clinical trial registries is, even though it is a different way of searching, you still need to report how, when, and what you search. So always keep a good record of what interface you used and the search strings that you used. So something else that you're going to want to think about whether there will be anything available in it is grey literature. So this is information that falls outside the mainstream of published journal and monograph literature and isn't controlled by commercial publishers. So it's really good for topics where there are likely to be hard to find studies or possibly governmental or private sector research. When you search for grey literature, the best practice there is to be specific about what you're looking for before you start searching. So what do you expect to find? What do you hope to find within the grey literature? Whether you have geographic or time limits. If you're going to be searching something like Google or Google Scholar, you need to be mindful of when to stop, because you could probably go on and on with Google or Google Scholar for a long time. So keep in mind, okay, I'm only going to search the first 10 pages. Set yourself some sort of limit, or you'll set a limit of when the same results start to show up again and again, you'll stop searching then, or when the results start to become irrelevant. A really good thing that you can do with Google is actually to look for a specific topic on a website within Google. So most websites will have like a search, their own search, but you can use a Google advanced search and narrow the results by site or domain. So you can look in that specific site, or you could do .edu or .health.gov.au or whatever, because that's actually a little bit more sensitive and it will find more than what the website search will find. Again, just as with clinical trials, even though you can't be as structured as with those bibliographic and citation databases, you really need to be sure to still keep well-documented records of what you did. So if you're using Google or Google Scholar, keep a record of your search string, what you looked for, where you searched, how you searched, and include it in your final paper. You can also use, there's a tool, a checklist that you can use to evaluate grey literature as well. It's called the CAHS checklist, and again, that is linked in those resources. So another supplemental form of searching that you can, I do recommend using it when you've got your final set of results, is citation analysis. So this can be done on your final set of papers, and you can do backward citation chasing, which is looking at the references cited in a relevant paper, and you can do forward citation chasing, looking at the articles that have cited a relevant paper. There are quite a few free tools that will assist with citation chasing. Citation Chaser is one that I use quite often because you can just add in your list of articles in various different ways, whether it's DOIs, PMIDs, or uploading a CSV or a RIS file. And that will search forwards and backwards. That will do forwards and backwards citation chasing for you. You've got Research Rabbit, and that's a free online citation-based literature mapping tool. So again, it supports both forward and backward citation searching, but it also generates visualizations of the connections between the papers. So for anyone who prefers, is more of a visual person, that can be quite helpful. And then there's also Spider Site, that allows you to input a library of articles and generate all the forward and backward citations, but just one level deep of those articles. PubMed and Web of Science also allow for, well, PubMed only allows for forward citation chasing, sorry, and Web of Science allows for forward and backward, but only at the individual article level, so you can't input a whole load of articles. You can only do it on a single article at a time. Some other ways of finding relevant papers for your synthesis are if you received an on-topic paper from a colleague, someone shared something on social media, contact study authors, like things like clinical trials. If you see that a clinical trial was started and it looks like it should have been finished, contact the study authors, see if you are just not finding that particular publication, or maybe there was a delay or something. And then also hand searching, which is going through papers to find what they have referenced. I don't have it on here, but another really good way of getting relevant information is setting up subject alerts on databases. So that will send you emails regularly on new research that has come out, new papers that have been published on your topic. So just some last tips for searching. Keep a record of your searches. Use the Prisma S checklist. I would say, even though this is for reporting, I would say have a copy of it near you while you are doing your search, because it will keep you on track and it will make sure that you are recording the right things that you need to report on later on. I do have a link to Prisma in those resources as well. So avoid narrowing your search results with age, date, language limits. We talked about how that would could end up in relevant literature being lost. Search line by line to be able to spot any errors really quickly. Search across multiple databases. If possible, consult with a trained medical or health librarian. And always use your database guides. So manuals and handbooks are really helpful for conducting your evidence synthesis. So basically it will guide you on how to conduct whichever type of evidence synthesis that you're doing. So you've got ones for scoping reviews, for qualitative evidence synthesis, and for systematic reviews. Then you've got your reporting guidelines, and just remember that the methodological guidelines are different to the reporting guidelines. Something like the Cochrane Handbook is telling you how to conduct your evidence synthesis. Something like Prisma is telling you how to report it in your final paper. Just another quick word on some useful software to help you manage your results and also to help you deduplicate when you get all of your final results across your databases. So once you've searched on all your databases and you pull all your results, you're going to want to deduplicate them. So I tend to use something like Assist, which you can upload all of your results into, and it will deduplicate for you. Confidence can help with that as well, and EndNote has an automatic deduplication in there as well. You've got reference management software, so you'll probably be familiar with EndNote, Mendeley and Zotero, and then you've got other review management software that actually takes you from the beginning of your review right through to the end for data extraction and all of those other last little bits that you need to do. So this brings me to the end of the presentation today. So I just want to finish up by stressing the importance of the literature search in any evidence synthesis. So as I mentioned before, a good quality literature search is the foundation for the entire, for your evidence synthesis, and it will ensure that your study is a useful and valid piece of research.
Great, thank you, Sarah. Any questions in the room? No, someone might be typing. I'll start with the question then. You talked about searching for grey literature and stuff. I've seen some scoping reviews and some softer searches that have included like YouTube videos and blog sort of based information. Is that still kind of appropriate to include within your overall searching?
Yep, if it's relevant, you can definitely include it. The main thing is to record it appropriately. And then report it appropriately as well. So with your Prisma, if you're using Prisma as your reporting guideline, you want to make sure that you're recording it on the in the appropriate area on your Prisma flow diagram. And again, just keeping really good records of what you searched and how you came across it.
Thank you. Any other questions in the room or online for today for Sarah?
Yes, I have one. It's a recording for this talk is absolutely excellent, outstanding.
Yeah, thank you. It is being recorded and we'll have the session online in the next week or so. Thank you.
Thank you.
Join me in thanking Sarah for her talk today. I'll just do a couple housekeeping things to finish off. No worries. Great, so thank you for today's session today. I hope you got a lot out of that. It will be online. Just to give you a heads up of what else is coming up in the Research Education Program. So this Wednesday we have World Clinical Trials Day. We have 2 workshops running for staff here based at PCH, which is fantastic. There's also some stuff going down in the foyer for families and the kids that come into the hospital. So if you're around, please come and look at some of those and register for the workshops. We also have on Friday the 29th of May conducting systematic reviews, so it's a nice kind of build-on session from what Sarah's already introduced today. So we'll dive a little bit deeper into that session. And then Tuesday the 9th of June we have data collection management as well. So again, just want to thank Sarah for her time today. We also would like to receive your feedback, so I'll leave the QR code up here on the screen if you don't mind completing that now, or if you're in the room and you have a paper copy, more than welcome for you to complete that.